Hi, everybody. I'm Lori Duthie, and I am your host for The Art of Awareness. And I am here today with my dear friend, Megan Erskine, who is the CEO of Catherine's Health. But not only is she a CEO, she's also a creative with a really long journey throughout her career, which has somehow led her from being in Second City in Chicago, being a photographer, a videographer, doing all kinds of stuff. And now she's a CEO. So we're going to talk about where creative and CEO merge.
Love that.
She's also like super tall and glamorous. And I'm feeling a little like short and dumpy, like I need to sit up.
No,
And
I
be
am
proper.
not
And
glamorous.
being a CEO, she showed up in a perfect, lovely outfit. Lori's here in Ugg boots, looking like I rolled out
This
of
is
bed.
a sweater dress.
It's a sweater dress, but it's a fancy sweater
Thank you.
dress.
Thank you so much. But I am not glamorous. If you knew me and you knew everything about me, you would know that I have an obsession with one pair of yellow sweatpants that I'm not sure I wash enough. But I'm obsessed with them.
Do they have like a school name? Are they branded?
Yeah, it says Comets on them. They're from high school, and I refuse. This is like a safety blanket for me. And somehow I never learned how to do my hair, which
I am with you on that.
Like no one taught me, but my sister went to beauty school and she knows how to do hair. And my excuse has always been, well, mom didn't teach us how to do hair. And yet my other sisters know how to do hair. So I think it's a me thing.
It's totally a me thing because my mom does brilliant braids. Yeah. So does my daughter. And like, I remember at some point she started, I'm like, no, mommy does two types of ponytails.
Yep.
The low kind and then Texas high. And so that as a little girl, she'd be like, give me a ponytail, mom, and make it Texas high.
Dance, right?
Well,
I mean, don't you
now
do her
she's
hair all the time?
Oh my God, there's French twists. There's like really complicated things. And I'm like, girlfriend, you be on your own. There's a lot of things your mom can do, but not makeup and not hair.
I am creative, but I'm not makeup and hair creative. Yeah.
So, and on that note, being creative, welcome everyone to our new studio. This is our new space, which we have created, and we're really happy to be here, and we're super grateful to my producer, Christy, for loaning us the space and place to make this happen.
It's really nice.
We've had a ton of fun doing it.
Yeah, and I think we're both going to move in, we decided, right?
We did.
Yeah.
We did. Yeah. We're both going to move in and hide out at Christy's house so nobody can find us.
Yeah, that's perfect.
So, Megan, let's start by tell me a bit about Catherine's Health, your role there. And then I want to go all the way back to like some of this other stuff to figure out how does one go from being Second City to CEO?
I hope we can discover that today because I'm not sure I spent a lot of time thinking about it, but this is why I'm really excited to be here because we can unpack it together.
I love it.
So Catherine's Health Center is a nonprofit healthcare place. We provide quality care, compassionate care, and most importantly, affordable care. We do focus on low-income people, but we serve everybody. And I truly, honestly believe the way that Catherine's provides care is different. It's relationship-based. Anyone who walks through our doors belongs there. And I continue to hear people from the community talk about how great Catherine's is in providing care. So,
and anyone can go there. Because I just met up with my friend, and she was like, oh, I go to Catherine's.
What?
I go to their Wyoming. Yeah, I'm overdoing an email to introduce you and Randy. Sorry, Randy. I'm super behind.
Randy.
Shout out to Randy at Mary
Shout
Free
out
Bed.
to Randy.
But yeah, anyone can go there, right? And then by going there and paying what your insurance, even if you're not on a sliding scale,
right,
you're still contributing to the overall system.
Exactly.
I love it.
Yeah. I think Catherine's, we're younger in our new community health center status. We've been around since 1996. We're celebrating our 30th anniversary. But because we're smaller and agile and lucky enough to have a lot of healthcare in Grand Rapids, it allows us to do like very niche services. So right now we're really focused on what we call place-based care or microsites, which is essentially bringing care to people. And
like via vans or...
Exactly. Yeah. And we're in shelters, we're in schools. We have some ideas around some other settings, but healthcare, people do not want to wait 6 weeks to get into their primary care provider. They don't want to.
I love my PCP. I have
but it takes a while to get
Dr.
it.
Rob.
What's up, Dr. Rob?
Dr. Rob is great. However, I agree with you. There's certain things when I'm told I need to wait 6 weeks, I don't even book because I don't know where I'm going to be.
Right.
I don't know what's happening, and then you fall behind.
Right. Exactly.
On your checkups, your preventative care.
Exactly.
So,
and if you have barriers like transportation or you have a job where it's hourly and you don't have PTO, just making it easier for people to be well, one, is better quality of life for them.
Yep.
But it supports affordability for employers, for the system. We all know healthcare is getting expensive, and this is not why I do the work. But it's what I tell business owners, and it's what I tell elected officials, and it's what I tell taxpayers. When people are well, we all do better. We all thrive. We reduce costs for everyone. People can contribute to their communities in different ways. So I love healthcare, not because I'm interested in health. Like if you ask me how the human body works, I'm not going to be able to answer it. I don't even know what gluten is, Lori. I don't know what gluten is.
You do. You kind of do. I kind of do.
But I feel
I know
like
it's in bread.
It's in bread.
Because I need to buy special bread.
And
for
perhaps
certain
it's in
special people my life.
beer. I've heard it's in beer.
I think is it in like hops and
Yeah, it's I don't know.
Okay, we're going to get
some answers.
Christy as producer, please make a note. We need a gluten specialist
Gluten specialist
to teach us about what it means to be gluten-free. What is gluten? Because I'm not sure I do know glucose and gluten.
Lori, exactly.
They both start with GL.
They start. But I think that why I'm interested in healthcare is that it intersects with community safety, it intersects with education, it intersects with social mobility. It's sort of the fundamental thing that allows everything else to work. You cannot be housed if you are not well. You cannot go to school if you are not well. You cannot go to work if you are not well. So why not just make healthcare accessible to everybody?
Crazy.
Wow.
Idea.
What a wild idea.
So, you're very CEO-like in this presentation, but I'd like to go back. I'd like to learn what brought you here and what was I love an interesting journey because when I meet with people who are, younger than, they're like, how did you go to China? How did you? And I'm like, there's something about early stage career where all roads are leading you somewhere.
Yes.
You just don't know where it is yet.
Yeah.
So where did you start? Right after school or in school? What did you?
Yeah, I think I'll share, something that was really formative, and I'm being vulnerable and transparent now, is that my mom was diagnosed with cancer when I was in high school. And I'm the oldest of 3 girls, and she died when I was in college. So I share that, one, because I saw how the healthcare system worked and didn't work. I share that also because my mom was a really important part of my life. And when she died, I realized I had no idea what I wanted to do because she...
Oh, I'm so sorry. It's a guiding force in your life.
It's a guiding force. And she being immigrant, first generation, as you can imagine, we were just like, this is what we're going to do. Megan's going to be a lawyer, get good grades, be good at everything.
This sounds like my family's broken dreams for me, too.
The Megan and Lori story.
She's either a doctor or a lawyer or an anthropologist. I'm a middle-aged podcaster doing it for you, Mom.
This is so perfect. We're thriving, though.
Yeah,
we're thriving.
we are. We're absolutely...
Yeah. So I went to college and I think I started like with international studies, and then I went to political science, and then someone in my class really annoyed me, and I was like, I'm not going to major in political science because this lady is going to be in all my classes. And then my junior year, I decided to be an English major because I took one poetry class with a professor named Di Seuss, who is now a Pulitzer Prize winning poet, but she was just like so cool and so accessible. And I really fell in love with writing. And then I started taking classes in documentary with another amazing professor named Dara. And both of these women like saved my life because I was so lost. And my volleyball coach, Jean Hess. So I went to Chicago after school, and I really wanted to do documentary filmmaking and just like couldn't find an internship. And then got an AmeriCorps position at the Illinois Maternal and Child Health Coalition. What is that, you say?
What is that? I do say. Tell me more.
I did statewide organizing for like the Affordable Care Act. I did youth organizing. So I was going to high schools all across Chicago, getting young people to like speak up for their rights related to healthcare. Fell in love with policy and advocacy. And then I had a quarter life crisis and said, you know what? I'm tired of this. I'm going to go into film and photography. And so,
As you do.
As you do.
Public health, film,
I mean,
photography.
it's like the natural progression.
It is.
You go
It
from
is.
youth organizing to.
It's like a crab walk.
Yeah.
Across industries. It's like, oh, I'm going over here. Now I'm going over here.
Just imagining doing crab walk, and I don't think I could anymore. And yeah, I love the creative. I love being around creative people. I love being around filmmakers and photographers.
Sounds like you have skill too.
I don't know if I had skill. I had like production chops. Like I knew how to do logistics and buy plane tickets and, make angry people happy. The talent.
The talent's a real
The talent. And then
peach.
I think like, you're the talent. I feel like a year and a half in, we were doing a Hormel ham ad. And it's not to say that advertising photography is not interesting, but we were just moving this plate around all day, getting different shots of like a ham sandwich or something.
How many hours of filming?
12. I mean, it was 12 hours.
Did you have to like replace the ham and the lettuce and like
spray it? And
you were the ham fluffer?
The food stylist.
Fluffing the ham.
I wasn't fluffing the ham.
Food stylist.
I was saying,
know,
food stylist, please fluff the ham. But
you were the director of the food fluffer?
Sure. Yeah. That's what we're going to call it.
I don't think that's appropriate. And my apologies to all food stylists anywhere and
it's
everywhere.
A skill. It is totally a skill.
It is a skill. So that was a long day, it sounds like.
Yeah. And I just decided I wanted to do more social justice, more purposeful work. So went to Chicago Public Schools doing student health and wellness, and then went to a community health center like where I work at Catherine's, and ultimately just fell in love with the community health center space because you're providing direct care, but you're also still involved with like the community social determinants of health. And I found out that I was like a really good leader and manager. And I think it's the creativity, and I think it's my improv skills.
How'd you end up in Second City? Like, where'd improv in between filming Bologna and doing Teach for America? Or like, and then somehow you just tripped into Second City. We're like, the Second City. We're like Tina Fey and Amy Poehler. Like, this is like legendary Second City. I'm so jealous.
Yeah, I just rolled in. So I feel like I felt like a failed creative. In my 20s, I felt bad that I was not doing film. I wasn't a writer. I had fallen into healthcare. And I say that because I have transitioned my theory of the case of what creativity is. But when I was 27 years old, I was not feeling good about myself. I just felt like, well, I couldn't cut it in the creative field. So now I'm in healthcare. And when I turned 30, I decided to take a improv class at Second City just for funsies. And then it grabbed my brain, and I did 5 classes there. And then I auditioned for conservatory, and somehow I made it into conservatory. And then conservatory has a second audition, and I made it through there. So graduated conservatory. And then I kept doing more improv. And at like one point, I think I was on 5 different teams doing improv every night. And then a lot of the lessons with improv, I just realized was like this. I truly believe if everyone in the world took one improv class, the world would be a better place. And I call it extroverted mindfulness because you have to be present. You have to let go of ego. You have to be listening, active listening to actually hear what the person in front of you is saying. Active listening, which you have to do.
I know my job as a talent.
And I was just like, I think some of these games or some of these lessons can apply in a workplace setting.
Oh, I think they totally can.
I mean,
and you
HR,
think whether it's like customer service or patient interaction, that ability to listen, decide on the fly, respond appropriately while coming up with the next response and being like, or like, I mean, public relations.
Yes.
I have worked for tech firms, and public relations teaches you how to say something without saying anything. Yeah. That was always my joke. I'm like, oh, I can absolutely respond to this without saying anything. That I really agree with that. I mean, there's something interesting because I meet so many people at early stage career who, like you said you felt like a failed creative. And I know I personally am a creative, and I started out as an academic, as an anthropologist. Next thing I knew, I was in corporate HR.
Yep.
And everyone was like, isn't that a disjuncture? And I said, no, because there's something about the lens you bring
Yeah.
to the world that when you can translate that into leadership skills or
Yes.
team building skills, just being a great person on a team,
Yes.
like you're finding your magic
Yes.
in new ways. And it's interesting because so many people are so intent on, I'm going to make it big.
Yeah.
And it's like, well, you are.
Yep.
But in a niche you maybe don't realize.
Exactly.
Is that fair?
That's exactly right. And I think about, I mean, I don't know enough about AI. AI is like gluten to me, where I'm like, I guess I could use it to write some paragraphs in a nicer way. Or like if I want to send a passive aggressive email, I can ask ChatGPT,
And
hey,
make it
can
be
you make
nice?
this less
Can you make
passive
this
aggressive?
less passive aggressive? Oh, totally.
But I think about the new economy of like a lot of jobs are just hard skills. I imagine the AI is going to be able to do a lot of those things. And I think about the human stuff, the soft skills, the creativity, thinking outside of the box, the agility,
the way we
nimbleness.
listen.
Yes.
Interface.
It's the soft skills that you
The
cannot
interface
replace.
cannot.
Yes. Yes.
I mean, I'm sure there's some people with very special chat GPT. I have my dear friend Brian calls it Chaticus. And I'm like, no, Chaticus ain't no person.
yeah.
Like, we need fine lines.
Yep.
Because I'm like, listen to those responses. Those are not at all the responses I give Brian. I'm like, dude, you need to check that. Don't you go being passive aggressive and introverted.
Right.
And he's like, I was really irritated by you, but then I thought about it. I'm like, ChatGPT does not irritate you. It just says what you want to hear.
Right. Exactly.
But I do think there's something about that, like drawing out of human innovation where
Yes.
we're in a room, sitting around the same table and throwing ideas out
Yes.
and throwing solutions out.
So solutions. I think so places like healthcare where very smart people are, right? Like if you are in healthcare, you are a scientific mind, you're a mathematical mind, you're a practical mind. I would say the same with engineering, et cetera. And I still think people can be the leaders in these settings, even if they don't have those hard skills, because creativity, you're not a painter, you're not an actress, whatever. Creativity still allows you to build teams, to know a lot about a little, to understand process and maybe not the what, to yes and to provide humor, to build people up. Like, and I also think just helping people see that there's a different way to do things.
Yeah.
Within reason, like you cannot cause harm, you need to like not break the law. But I found that hey,
Those
don't
are
break
really,
the law.
Oh my gosh, you must be a CEO. I
yeah,
can't
well,
break the law.
I can't break the law. I just feel like there's so many examples where I'm using my creativity to help shift direction and innovation or improvement in ways that, no, am I a nurse practitioner or a doctor? I don't know what gluten is, but can I help people think differently about the problem? Yes, I can. Yes, and.
Yes, yes,
Yes,
yes,
and.
yes,
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 and.
and.
Yeah.
I love the yes and.
It's my favorite phrase.
And I think too, for people who don't think they're creative. So I have a mother who's convinced she's a nurse. She's a registered nurse.
Yep.
Her world, she loves her black and white. I come in, I see your problem, I fix your problem. But yet I look at her and I'm like, but you get so creative.
Yes. Oh my God.
Like,
yes.
I think we have a narrow definition of creativity.
I love that. Yes.
Even for creatives, because we're like, well, am I being creative as a CEO? You are.
You are. Yeah.
And as someone who sees the world as black and white, you're still navigating around these things.
Yes.
It's like that Which Way book. Like, okay, we have option
Yep.
2. I think a lot of our, if you're too young for Which Way books, we grew up with these books where you turn to page 23 if you want the princess to go to the castle. And you turn to page 38 if you want the princess to go on a date with the prospective prince. I go to the castle.
Obviously, it's the best one.
Storm the castle. Who was it?
Princess Bride?
Yes,
Yeah,
Princess.
yeah.
Have fun
Wow.
storming the castle, kids.
Yeah. Yeah. Oh, think they'll make it? Not a chance.
Not a chance. Okay, so Megan, tell me a little bit. I know Catherine's Health is coming on their 30th anniversary.
Yep.
30 years. I was born in 1973, so that feels like 1982 to me, but I'm pretty sure it's like a little bit later.
Yeah, like 1996.
Like 96.
Yeah.
Okay.
Yeah,
now
so-
I cry.
So
I feel old.
you are not old. Yeah. So Catherine's Health Center, we are celebrating our 30th anniversary this year. And as a lover of community and organizing and just community health centers in general, the story of Catherine's is breathtaking. So the first clinic came about because the Creston Neighborhood Association, St. Alphonsus Church, and St. Mary's realized that there was a need in the community specifically for women and children to access things like well child visits and vaccines. And I just heard recently from one of those organizers who was there from the beginning that there was one family, and I think they had 10 or 12 children, and they were living in like the Creston Plaza area, and they wanted to get these kids to the doctor and realized there were too many barriers. Like, how do you get 10 kids to the doctors? And so they were thinking about buying like St. Mary's old like mammogram bus. And
just like traveling with 10 children.
Yes.
Yeah.
I mean, I don't have 10 children, but
no, I only have one, so I could drive a motorcycle. But I don't think we applaud babies on motorcycles in America. But I will say, like, we have friends who had 6, 7 kids, and they had to invest in. It looked like an Amazon van.
yeah.
Yvonne would drive that thing around like a crazy mama.
Yeah.
So yeah, I mean, but truly when I talk to people with many, many children, like, how do you book the dentist? How do you book the doctor? Like, because you can't just trickle in or your whole life is round and round and round.
Right. And doctors' offices are not going to, I doubt they would have let them bring 10 kids at one time. And if you're already resource constrained,
Somebody's going to break the fish tank.
or
I mean, the best behaved children. I mean, that's a long time to wait. Something's going wrong with the fish tank in the pediatrician's office.
that is such a specific reference. And my pediatrician definitely had a fish tank. Like, that's
My daughter still reminds me now that she's 16. She's like, do not touch the fish tank. I know you want to, but it is germy.
Your daughter's telling you that?
This is Stella, who's a teenager, who's like, Mom, don't go near that fish tank. It's all germy because all the kids put their hands on it.
She's good at managing up, it sounds like. Mm-hmm. So anyway, they were like, what are we going to do? And obviously this is just one family, and there are a lot of families in the same
But we
situation.
have one family in Creston looking for a solution for healthcare.
And so
I love that.
It's really amazing to think about just the neighborhood and people caring for their neighbors. Yeah. And so what ended up happening is they put together a very small clinic in the basement of St. Al's. And I had the opportunity to visit when I first started, and it was extremely humbling. One, because, when you work in bigger healthcare, you get really fancy and you get fish tanks. But my realization is, like, you can do healthcare anywhere. And I think about that as we're doing some of our place-based care. Also, I'm really tall and I could barely stand up in the basement. So I'm glad that, we didn't have the basement when I started. Otherwise, I wouldn't be able to go in the clinic.
Or you would have a lot of back pain.
Yes, a lot of back pain.
In which case you would have other medical needs.
Right. I would be a whole problem.
Yeah.
And so one of these doors don't exist anymore. But when I looked at old photos, there were these blue doors at this clinic, and the blue from those doors became Catherine's kind of branded colors. So connecting back to the creative part, I'm sure people reference the blue doors, but using my sort of English major, thinking about symbols and semiotics and myth making and lore, it just occurred to me that these blue doors were Catherine's brand. It's our origin story and it's who we are now. And so we created a all-staff award called the Blue Door Award that we've been doing for 3 years to start creating that myth-making and that lore. We talk about the blue doors a lot when we talk about our values. And what the blue doors mean is that anyone who walks through our doors, whether they're metaphorical doors or not, you will be treated with dignity and I'm going to cry.
I know I'm going to start crying because you started, how many patients do you serve on average in an average month or whatever?
We saw 7,000 in 2025.
7,000 patients.
Yeah, but we started with
1,000
patients.
And you started with 10 little kids.
Oh my God, I didn't think about
walking through the blue doors in the basement of a church.
That's really too.
And now you're at 7,000 people. I mean, that.
It doesn't matter
I'm
who
sure
you are.
the services and just anyone of all walks of life and all economic standing.
Yes. I mean,
I am going to cry now.
it's okay.
Because
I'm
like,
crying.
you just picture these little kids going through the blue doors, and
Yep.
then you're like, oh, we all get our blue door.
Yeah. And so I think we have 14 locations now. And when I go to these locations, I literally visualize these like metaphorical blue doors in front of every location. And I hadn't thought about those 10 kids. And that's what's making me cry. It's like, that's how it started. So, yeah.
I really want to like find the parents and the 10 kids and like really thank them. I mean, that's so amazing when you're one family with a need.
Yep.
And then you realize so many people around you, because it's so hard to say we have a need as a family.
Yep.
And yet being able to service one family becomes being able to service others. It's like exponential.
Yep. Yeah. It's family to the...
It's a multiplier.
Yes.
It's... Christy, my producer, loves the word force multiplier.
Oh, wow.
So I'm trying to drop it in and impress her.
Thank you,
Christy. It's a force multiplier.
It's a force multiplier.
But no, I really appreciate that story. Like that is, so tell me a little bit more. What are the activities for the 30th? How do we get involved with Catherine's Health? Like, what do you need from the community? How do we find you for healthcare? Because I know a lot of people, especially our younger generation, is in between jobs and struggling to figure out how healthcare works.
Yeah. So go to Catherine's website, which I will put on the screen because I never know what it is. What we need help with is awareness. We want people to know about Catherine's. We're sort of newer to the scene, and the more that people can spread the word about who we are and what we do, the better.
Yep.
You can become a patient. We see everybody. It doesn't matter if you are commercially insured through an employer or uninsured. We will see everybody. I think populations that I'm really interested in serving are those young invincibles, the gig workers who don't have insurance. A lot of people are also choosing to go uninsured because the marketplace, those tax subsidies changed. We can see you if you are uninsured, and you will pay a very reasonable sliding scale fee. I think it's like $5 for the lowest range.
Yeah.
And then the third thing would be, of course, we will take a generous donations too. But I don't start with that because I'm really interested in awareness building, become a patient, tell people about us. But we are having an event on May 7th at the Frederick Meyer Gardens. It starts at 6 p.m. And we have some really exciting, I don't love events. Lori, I don't love putting events on. I think
Kind of anti-gala.
Yeah, me too. And
I just don't. But there are events I show up for, and I will say some of my favorites happen with Freddie and his flowers.
Freddie and his flowers. And the
I
butterflies
love
are
Frederick
going
Meyer
on right
Gardens.
now.
I gotta say, like, it's one of those places. Every time I go, I'm like, why don't I come here more often? It's a
so
great
good.
place to take a walk. It's a great,
so good.
like the little kitty section is so cute. It makes me wish I had little kitties again.
And succulent section, really nice.
Succulents are lovely.
We don't do events often, so this is the big one.
Okay.
And we have Dr. Jim O'Connell as our keynote speaker. He is the most generous, kindest man. He is a doctor out in Boston who essentially created the Healthcare for the Homeless program that many of us model our Healthcare for the Homeless programs on. There's a very famous book written about him. He is just a scintillating storyteller. I am really excited about Dr. Jim O'Connell coming. And then we made a documentary. So, you go to these events and sometimes it's like the same video over and over again. And we said, not us, we're going to do a documentary.
Full on documentary.
Back to the creative piece.
Yeah.
These guys doing the documentary are my friends from Chicago, and we did documentaries together, and they moved back home.
So it's all kind of coming full circle.
Yes. Yeah. So it's really fun, like collaborating with them again. And then Dr. Jim O'Connell is being gracious enough to do a fireside chat with us at Aquinas College in the morning.
Okay.
So I think events
Lots of events.
A lot of events. May 7th is the day. Go to our website. And we don't often ask people to come out for events, but we are asking people to come out to this event because it really is a celebration of Catherine's Health Center with some really interesting programming too.
It sounds great.
Thank you.
Do I have to wear a fancy ball gown?
You don't. No, please, no.
Can I wear my Ugg
You
boots?
can wear your Uggs.
Thank you.
Just like
We're very calm as you are with the art of wearing.
you can wear whatever you want, and I just would love to see your smiley, shining face. That's all.
It sounds great.
Thank you.
And you will find me there.
I can't wait.
And on that note, so since we're called the Art of Awareness, I'd love to hear a little bit about what you believe the art of awareness means to you, what you wish others were more aware of. Just give me some little blip on awareness.
Yeah, I think for me, I mean, I already said that I already talked about improv and it helping me be present and the extroverted meditation. But as we were talking about this story with these 10 kids, I think the art of awareness is being aware of unmet needs, whether it's your neighbors, family, friends. See, I'm going to start crying again. You don't have to do big things. You don't have to do these big sweeping policies or whatever, but maybe your neighbor is in the hospital and they need help taking care of your cat. I just think the world is really hard right now, and it's very easy to disassociate. I mean, I love me some TikTok. Okay, I need 30 minutes of TikTok every day.
I'm an Insta girl, but I'm down with that. It's French fries.
Yes.
French fries in your life, but then you're like, I need something heartier.
Yes. And I think just allowing yourself to live in the world, even if it's painful, even if it's hard, and just being aware of what the needs are around you, because you will pay it forward, and people will be aware of what you need when your time comes.
People really do.
Yep.
Pay it forward. And I think that's true. Small acts of kindness. And I mean, one of the reasons we're doing this is so people can hear from people like you and sort of hear other people's stories and be like, you know what? I'm a creative. I'm making my way. Here's what I have to offer today.
Yep. Come work
Here's
in
what
healthcare.
I'm good at. I mean, but honestly, I feel like it's always feels like a choice.
Yeah.
Like my dreams or stability. And I wish I could have hugged every little 25-year-old, including you, Meg, behind the camera, little artistic director.
You young person.
I mean, but there is this generation, and I remember being there and being like, am I going to make it, do something I love? And I'm like, it all comes together.
Yeah.
And I love that about your story. I love the improv piece.
I do too. Thank you so much.
And I hope you'll give me an opportunity to do a little improv exercise.
I think we did it with Kabuki Theater.
Oh, we did do Kabuki Theater. That was just our warm-up.
That was just our warm-up.
I think I don't want to say I could be good, but I fancy myself.
You will be good. I know you will be good.
A comedian.
You are a comedian.
That's French for
comedian?
Yeah, it's French and feminine.
Oh.
Comedian.
My two favorite things. French and feminine.
Mais oui, mademoiselle. Merci beaucoup.
De rien.
And with that, I should probably read us out.
Let's do it. This has been great. Thank you for having me.
Thank you so much for coming. This was really, really fun.
Really fun.
And I'm excited to celebrate with you on Catherine's House.
Thank you. Thank you.
Thank you so much for listening. Again, this is The Art of Awareness, and we really appreciate your support. You can learn more about us, learn about our Come and See our events. Our first one will be held in March. We'll have a follow-up one in June. Go to theartofawareness.org. That is theartofawareness.org. And you can also follow us on YouTube, Apple, Spotify, or wherever you get your podcasts. We're extremely grateful for my producer and most patient person in my life right now, Christy Hollingsworth. She needs to jump on a Zoom call with girlfriends, so she needs to get out of this room. And then my wonderful artistic director and person on sound today would be Megan Hollingsworth. And huge gratitude to Megan Erskine, our guest today. Thank you again. And until next time, stay aware and keep connected.